CDC. A young boy rubs the top of his head. A red spiral rotates above his head. A woman runs toward him. Then, a boy sitting in front of a fallen bike rubs his head. Another boy rubs his head while standing between puddles of water on the floor.
Traumatic brain injuries, including mild traumatic brain injuries, mTBI, are a major problem for children.
A head with a visible brain whips backwards. The front and back part of the brain lights up and a lightning bolt flashes in the middle of the brain.
This injury leads to pathophysiologic injuries and associated symptoms that can result in poor physical, cognitive, or psychological function.
A woman wearing a white coat named Doctor. Maggie talks on the phone as she sits behind a desk.
In this video, we'll explore the current diagnostic criteria and unique considerations for mTBI in children.
A flowchart for the 6 criteria appears.
In 2023, the American Congress of Rehabilitation Medicine, or ACRM, published an updated diagnostic algorithm for mTBI that includes 6 criteria. Criterion 1. There must be a plausible mechanism of injury reported through direct observation or witness report.
The number 8 football player tackles the number 23 football player.
This may include an external force to the head or to the body that causes the brain to move back and forth, or a transfer of energy to the brain from a blast or explosion. If a plausible mechanism of injury is established, healthcare providers should review the other criteria in the algorithm. Criterion 2. 1 or more clinical signs that present immediately after the injury.
A young girl slumps over her desk. A baseball player stares blankly and shrugs his shoulders. A text bubble above a lacrosse player reads, "I don't know."
These may include loss of consciousness, alteration of mental status, such as acting confused, disoriented, or dazed, complete or partial amnesia, acute neurological signs, such as motor incoordination or seizure. Criterion 3. 2 or more new or worsening acute symptoms that present immediately after or up to 72 hours post-injury.
A question mark pops up in a text bubble over a boy's head standing in front of lockers. A girl presses her forehead with the palm of her hand. A text bubble above a boy reads, "What day is it?" A boy frowns and his face turns red.
These may include alteration in mental status, physical symptoms such as headache, nausea, dizziness, or balance problems, cognitive symptoms such as feeling slowed down, difficulty concentrating, or memory problems, emotional symptoms such as emotional lability or irritability.
Text. Criterion 4. Clinical examination and laboratory findings, 1 or more.
Criterion 4. Abnormal clinical examination and/or laboratory findings.
A woman writes on a clipboard as she leans down to a young girl. A girl looks down as she walks slowly. A text bubble above a girl reading a book reads, "Things look kind of fuzzy."
This may include cognitive impairment on acute clinical examination, balance impairment on acute clinical examination, oculomotor impairment or symptom provocation in response to vestibular oculomotor challenge on acute clinical examination, elevated blood biomarker levels indicative of intracranial injury. Criterion 5. Abnormal neuroimaging findings.
A person in scrubs looks at images of a brain on 2 screens.
If completed, this would include intracranial abnormalities on CT or MRI.
Text. Criterion 6. Not better accounted for by confounding factors.
Criterion 6. Findings in Criterion 2 through 5 are not better accounted for by pre-existing or co-occurring conditions. The ACRM diagnostic algorithm also indicates that patients who have a plausible mechanism of injury and 2 or more acute symptoms, or 2 or more clinical or laboratory findings, but do not meet other criteria sufficient for diagnosing an mTBI, should be diagnosed as having a suspected mTBI.
Text. mTBI versus TBI. The mild qualifier is not used if any of the injury severity indicators listed below are present. Loss of consciousness duration greater than 30 minutes. After 30 minutes, a Glasgow Coma Scale, GCS score of less than 13. Post-traumatic amnesia, greater than 24 hours.
And a patient should receive a diagnosis of traumatic brain injury instead of an mTBI or mild TBI if they experienced a loss of consciousness greater than 30 minutes post-injury, have a Glasgow Coma Scale, GCS, of less than 13, 30 minutes post-injury, experience post-traumatic amnesia for greater than 24 hours post-injury. Future definitions of TBI will likely include a new classification system that moves away from the traditional mild, moderate, and severe classification scheme.
How mTBIs happen.
Now let's explore the series of events leading to a pediatric mTBI.
A head with a visible brain whips backwards. The front and back part of the brain lights up, and a lightning bolt flashes in the middle of the brain.
An mTBI is associated with a force or an impact to the head or body that causes the brain to accelerate or decelerate with translational and angular forces.
The camera zooms inside the brain, revealing lines extending in all directions from circles. The circles flash red, and a lightning bolt appears.
These translational and angular motions stretch the neurons, triggering a complex cascade of ionic, metabolic, and physiologic events, often resulting in microscopic axonal dysfunction. So why are mTBIs in pediatric populations especially common?
A young boy sitting on the floor picks up a block.
Reason 1. A developing brain. Children's brains are still developing, with less white matter, myelination, and synaptic pruning. These factors make children's brains more susceptible to stretching, as well as chemical and metabolic changes associated with mTBI.
A figure splits into muscles, nerves, organs, a skeleton, and then a black form.
Reason 2. A developing body. Children have less developed musculature, including cervical and shoulder muscles, making them less able to absorb mechanical energy.
A boy walks past trees.
Reason 3. Curiosity. Children are naturally curious and engage in more risk-taking behavior.
The boy balances on a log fallen across a stream. He loses his balance and falls into the water.
While this trait supports learning and development, it also increases the risk of injury, including mTBI.
A boy with an exposed brain walks forward.
Most children who experience an mTBI will have a good recovery. But for some, an injury to the developing brain can disrupt a child's development and negatively impact behavior and cognitive skills, potentially altering developmental trajectories across multiple domains.
The scene returns to Dr. Maggie talking on the phone.
As a healthcare provider, your role is crucial in providing the best possible medical care to children affected by mTBI to ensure positive outcomes for their long-term recovery.
Text, click the next button to continue. An arrow points to the bottom right-hand corner.